We are wrapping up the month of March with a wellness watch, and here to kind of guide us through is Scott Plaehn from Digestive Health Institute. Welcome back into Studio 10.
Oh, it's good to be with you.
Yes, it's always great to have. These are important conversations that we always have with wellness watches. Now, we've had Digestive Health Institute on our show before to kind of talk us through colorectal cancer because it's so important. But since it is Colorectal Cancer Awareness Month, talk us through some of the things that we should be aware of when it comes to this kind of cancer.
Well, first of all, it's the third leading cause of cancer death in the U.S. and worldwide. And so it's a concern that if it's a preventable condition, we need to take the steps to see what we can do to reduce the frequency and the severity of the illness. And it's really in our control to help prevent this from even developing and to help us prevent it from occurring. And I think it's a great month to focus on it.
That's right, and start these conversations for those that might not be aware. Now, what kind of screening do you need for colorectal cancer? Where do we start?
Usually we start with our primary care physicians, who are the frontline physicians who will refer patients to us. It typically involves a colonoscopy, which is really a painless exam that will take 15 to 20 minutes to try to identify polyps and precancerous lesions.
Okay, and you mentioned polyps. Can you talk us through what that exactly is so that way, we're more aware of everything?
Sure, it's a very common question patients have and families have, but basically a polyp is a precancerous lesion that if we can identify it and remove it, it will reduce the cancer risk by up to 95% of the time. So it's important to find and identify those patients not only that have them, but also to involve them in a more aggressive screening program in the future, depending on what we find during the exam.
Got it. So what stands out about the cancer that you are finding, when you do these screenings?
Sure. When we were first in practice, cancer of the colon seemed to be more of an elderly or in patients that were above age 50, but now I think the trends are developing where we're seeing cancer develop in younger groups, such that we're now reducing the age of screening from 50 to 45. Okay. And even with that being said, there may even be patients under age 45 that are developing colon cancer and rectal cancer in frequencies that we hadn't seen in the past.
And do you know why, or why do you think this is?
I mean, that's a great question. Everybody's asking that question. Nobody really knows the answer, although there's speculation. Does it have something to do with lifestyle? Is it the foods we're eating, something environmental? I think there's a lot of investigation and interest in trying to identify what are the risks that are causing this shift in the trends and the demographics of the cancers.
Right, but we do know is that we do want to prevent this. I know you mentioned that in the beginning. So what, I guess, is the best thing we can to prevent it? Is it starting with those screenings?
Screening is really, I think, the best way to get in front of this and to get ahead of any potential problems and reduce the cancer risk by reducing the frequency of polyps by removing them and identifying those patients who are at increased risk and families who may be at increased risk, so we can, again, prevent this from even being a discussion.
Right, exactly. Well, thank you so much for talking this through. I think these are the conversations that we need to have, especially since, we're seeing, it become, more the younger 45, and having these screenings and all of this. So we appreciate you stopping by and talking through all of this. And of course, we have information on how you can start these conversations on your screen. But thank you so much. Any other things that you want to give our viewers when it comes to this cancer? Any advice that you have?
And the more we talk about it, the less it causes anxiety and worry. I think if we can just be much more open about it and we can investigate things more and participate in screening programs, I think we will have a lot less concerns in the future.
I like that. Well, it all starts with conversations and some wellness watch. So thank you so much for stopping by.
Thanks for having me.